Hello, I'd like to welcome you today, School Nurse Day 2022, to a day in the life, a photo essay of the Wisconsin school nurses and the COVID-19 pandemic. My name is Teresa Duchateau, and I am owner and co-founder of School Health Associates. I'm also the photographer and project director for the Day in the Life project. I would like to introduce you to one of the partners on this project, Louise Wilson. Louise is the school nursing and health services consultant with the Wisconsin Department of Public Instruction. I have shared this with Louise, but wanted to say it again. Every nurse that I met with as part of this project mentioned Louise. They all had shared how supportive she has been and the help and guidance she has provided, not only in the past 2 years, but the entire time she has been with the Department of Public Instruction.
All right, thanks for having me. So greetings to all of you who are gathering today in this virtual space to celebrate School Nurse Day and mark the incredible contributions of school nurses. I am left to wonder, like many school nurses, why did it take a pandemic for school administrators and the public to recognize the value of school nurses and that each student deserves and needs access to school nurse daily? It has been said that school nurses are the hidden healthcare system. Pre-pandemic, during the time of school closures, and over the past 2 pandemic-driven school years, school nurses have not just focused on infection control and public health mitigation measures, but provided care coordination and direct services to many students with acute and chronic health conditions. Those students include children with life-threatening allergies, seizure disorders, diabetes, asthma, sickle cell anemia, those that require tube feedings, catheterizations, and medication administration. For 2+ school years, school nurses provided these services with a worldwide pandemic in the background. Yet, as I suspect the video we are about to view will demonstrate, managing the effect of the pandemic on their school community was at the very foreground for school nurses. School nurses provided leadership in navigating the ever-evolving and changing infection control and mitigation strategies to mitigate the risk of disease transmission in schools. They contact traced those exposed to the virus, tested students and staff who experienced symptoms, planned and manned immunization clinics, provided education, resources, and reassurance to parents, caregivers, students, and staff. School nurses did this all while providing direct care to the acutely ill or injured students, managing the effect of chronic health conditions and school attendance and success, planning for the effective response to life-threatening health conditions, providing medication management, performing or delegating skilled nursing care, and supporting student and staff wellness and mental health. On this School Nurse Day in particular, the Department of Public Instruction is proud to acknowledge and honor the school nurses who have been the face of public health nursing in their communities, not just their schools. As the state school nurse and health services consultant for the Wisconsin Department of Public Instruction, it is my pleasure to greet all of you, and it's my honor to have the opportunity to advocate for school nurses, who in turn protect and promote the health of our Wisconsin school children today and every day. My message to school nurses is simple. Thank you for choosing the specialty of school nursing. Thank you for bridging the very different systems of healthcare and education. Thank you for not only surviving these pandemic-filled school years, for giving the students the opportunity to both survive and thrive. Thank you.
Thank you, Louise. I would also like to thank and acknowledge the project partners that helped make this project a reality. They include the Wisconsin Association of School Nurses, the Department of Public Instruction, and the Wisconsin Nurses Association. I would also like to give a big thank you to my partner at School Health Associates, Betty Carr, who has helped support the development and implementation of this project. And I would like to give a huge thank you to all the school nurses that I had the pleasure of spending the day with as part of this project. We were also very fortunate to work with two humanities experts, Holly Romano, who's on this webinar with us today. Thank you, Holly. Thanks for joining us. Holly Romano is a journalistic, commercial, and fine art photographer. And Dr. Lori Glass, who is Professor Emerita and Director for the Center for Nursing History within the College of Nursing at the University of Wisconsin-Milwaukee. I'd like to thank Holly for her kind words and thoughtful critiques. After each school photo shoot, Holly would review the photos I had taken and provide feedback and recommendations. I shared with her at one point, after she had sent me an email filled with helpful suggestions on how to make my photos better, that her critiques felt like warm hugs. And a big thank you to Dr. Glass, who lent her support to every aspect of the project and was super helpful in reviewing the multiple drafts of the grant proposal. This project is funded in part by a grant from the Wisconsin Humanities with funds from the National Endowment for the Humanities and the state of Wisconsin. Any views, findings, conclusions, or recommendations expressed in this webinar or in association with this project do not necessarily represent those of the National Endowment for the Humanities. One of the goals of this project was to document this moment in time using words and photographs. As I mentioned, we partnered with Dr. Lori Glass with the Center for Nursing History. Dr. Glass's expertise in nursing and history helped inform the information that was collected and documented during each school visit. I've asked Dr. Glass to share why she believes this is such an important time in nursing and school nursing history. Dr. Glass? You have to unmute. There you go.
How's that? Thank you, Teresa. This certainly was a very exciting and important project, and it is a story that needs to be told. It documents the experience of nurses who have not been in the limelight. We've seen plenty of coverage about nurses in acute care facilities during the pandemic. The public health nurses have gotten a little bit of coverage, but the school nurses have been the subject of very little coverage. I know there was a public radio program that was done, but beyond that, the importance of your role, I don't think was adequately covered. And with Teresa's project, I hope now that you will get more recognition for the job that you do. During COVID, that's a historical event. And school nurses, just like other nurses, have not ever been through this. School nurses have a complicated role. And as I've been working with Teresa, I thought more and more about that. And the kind of things you do. And as I believe Louise said, you are essentially a healthcare system. You had to deal with virtual transformation very quickly, as many of you were not going to be in your usual settings. And many of you had to take on jobs that you weren't familiar with, such things as contact tracing. Who thought we would be contact tracing in the large numbers that we were, to the point where, some health departments had to sort of give up on it and ask people to do their own because it was just too much to be done. As time moved on, then the school nurses also ended up dealing with parents, school boards, principals, and others whose ideas about what should really be happening weren't necessarily the same. And I'm amazed at the political finesse and negotiation skills that the school nurses ended up having because of the situation in the communities that they were in. As we say, the past is prologue, and it's important to document this work for a number of reasons. One of them is that hopefully somebody will learn something from the video and the work that Teresa has done. They might be able to, in the future, get some ideas about how to respond to this, How many times did we hear people talk about the Spanish flu of 1918? There's also was the polio epidemic, which nurses were very involved in. And you look back on those and say, oh, maybe this is something we could do. Maybe we can, their actions can be modeled. And looking at the change in roles, it will help people predict what's coming if we ever have to do this again. It will also give credit to the nurses, to the school nurses, for the courage and the resilience that they have had for the past 2 years in trying to deal with all the various factors that you've had to deal with. Over time, this project will be reviewed as a record, a historical record, and it's always important to record history as it occurs. In regards to that, I haven't mentioned this to Teresa, but I'm hoping that your dissemination of this, Teresa, will also go. The Wisconsin Historical Society has a COVID project. They are collecting all kinds of documentation about how we as citizens of Wisconsin made it through 2020 and 2021. And I hope that this will be shared with them so that it too will be entered into the record of the great COVID-19. Thank you. It's been a pleasure working with you, Teresa.
Thank you, Dr. Glass. So now I'd like to tell you a little bit more about the day in the life, a photo essay of the Wisconsin school nurses and the COVID-19 pandemic. The project planning began in December of 2021, and the goal of the project is to acknowledge and honor the role that school nurses played historically and during the COVID-19 pandemic to support the health and education of students and to document this important period in school nursing history through words and photographs. When I first imagined embarking on this project, my plan was to spend a day with each of the school nurses and capture photos of them in action. I believed the photos alone would be able to tell the story of what the past 2 years had been like for Wisconsin school nurses. From the beginning, I planned on interviewing the nurses to hear about their experiences managing the pandemic. I thought I could listen to their stories and capture images that expressed what they shared during their interview. Shortly before the project began, I made the decision to videotape the nurses' interviews, as this would allow me to rewatch their interviews after my visit and pull out details that could inform the captions for the photos. After the first 2 school visits, I realized how powerful it was to hear and see the nurses as they told their stories. I could see the physical relief that came over many of them as they had the opportunity to put words to what they had experienced. I realized how important it would be to include the videos as part of the project, as the videos captured the emotions, experiences, and challenges that the school nurses experienced in a way that a picture could not. Additionally, most of the school visits occurred in March of this year, and the photos that I captured were more reflective of the role of the school nurse prior to COVID, since many schools were no longer requiring masks or social distancing. Today, you will hear and see the stories of 9 school nurses. We will begin by sharing some clips from the interviews with the nurses, but first I want to introduce you to the school nurses. Laura Burnack is a school nurse for 3 school districts in central Wisconsin, Edgar, Marathon, and Richoldt. Suzanne Brinkman is a school nurse for the Basketball Area School District. Sharonda Farrington is district nurse for the school district of Brown Deer. Kimberly Hess is a school nurse for Glendale River Hills and Mapledale Indian Hills school districts. Jennifer Marsh is a school nurse with the Superior School District. Emily Oyam is school nurse with the Lafarge School District. Sue Richards is a school nurse at Edgewood High School of the Sacred Heart in Madison. Jenny Sauve is school nurse for Spring Valley School District. And Kristen Strong is the district nurse for the McFarland School District. And this map shows the locations of the 11 schools and districts that I had the pleasure of visiting. As I mentioned, each visit started out with an interview in which the nurses shared details regarding their school nursing practice and reflected on what the past 2 years had been like for them. Each one of the school nurses shared that at the onset of the pandemic and during the peak periods, they worked far beyond their assigned hours. Some of them were compensated for these extra hours, others were not. During the summer of 2020, the school nurses worked numerous extra hours educating themselves about this new virus because they felt a professional responsibility to inform themselves and prepare as best as possible for the upcoming school year. In this video clip, the school nurses recall what they remember most from when the pandemic first started.
I think just kind of like probably most people, a fear of the unknown. I can remember writing my pandemic flu plan a few years back, and a lot of people, both on staff here and personal friends and other professional colleagues, those that knew about that phase of community health, okay, this is happening, but we knew it could happen, and other people were really truly scared. So I guess I was in the middle somewhere, but I was fearful, you know, for my own family, and obviously like the rest of us watching and learning about the pandemic from reliable resources. But I remember those reactions, and also thinking, you know, this is what we prepared for, sort of. It sounds like a movie, but you know, we can do this. We know what to do. We know what to do, how to plan for it. We have to wait for the information, but there was still some fear of how I was going to do my job and take care of the students and staff, and fear on a personal level about illness and death.
It's interesting.
I remember feeling like there was a lot of pressure on the nurse. Administration was coming to the nurse saying, you know, what's the game plan? What are we going to do? Where's the pandemic plan? And just feeling overwhelmed. I remember thinking and saying in one meeting with administration, well, you know, things hadn't hit at that point in the United States. And so I remember thinking like, well, if anything gets, you know, real big and out of control, I'm sure public health and DHS is going to tell us what to do. And I was like, I need to get this pressure off of me. Just really a lot of unknowns. But then, you know, after schools closed and over the summer, and thinking like realistically, this didn't go away. It's not that quick couple weeks to flatten the curve like we were all hearing in the beginning. I remember having this, like one day just really realizing that my whole job was going to change, and just having like this moment of, so I'm basically getting a new job that I didn't sign up for, and feeling a lot of stress and worry about that and how that was going to go.
I remember we went home on Friday and found out that we wouldn't be coming to school on Monday, and at the time we thought that we would be home for 2 weeks, so we didn't send the kids with any of their things, obviously, because we found out after school, because I think at that time it was 2 weeks to kind of slow the spread. And I remember worrying about kids that were home as we found out we were going to be home longer. Just, do kids have enough to eat? Is somebody there to take care of them? I was part of a team that tried to figure out how to get food to kids in our community. We have a backpack program that is run through volunteers, and our school helps with that. And so myself and a few other staff partnered with the community, who dropped off a bunch of different food donations at my church that I go to in town, and then we packed it all up, and then our bus drivers would come, grab backpacks full of food, and deliver it all over the community to kids that needed food.
Worried. That was my first thought when we shut down, was worried about where are the kids going to get resources? Who's going to be their person while they're gone? Where are they getting lunch and breakfast from? Dinner. We have an after school dinner too that we provide for the kids, and this makes me want to cry. But worrying about who's taking care of them. If they didn't have the 8 hours a day here with a trusted adult. Yeah.
I would second that. So we shut down, we were going on our spring break. And so it was that Friday, and there was anticipation that we would go into a lockdown, but we weren't going to be in school the next week because it was spring break. So I remember being pulled together in a meeting, and we were all these people at the table, and everybody's talking about, well, how are the kids going to continue to learn? If we shut down, how are they going to continue to learn? We got to get them devices. We got to get them plans. You know, do we send textbooks home? And my thought was, that's not what parents are scared about right now. They're scared about who's going to watch my children. How are my kids going to eat? So I was worried, and that was what my voice at that table was. I'm not worried about that. I'm worried about their health needs. I'm worried about them eating, you know.
As the school nurses thought back to the beginning of the 2021 school year, they recounted spending evenings and weekends calling parents and guardians, informing them that their child had been a close contact of someone with COVID-19, constantly monitoring their emails, and participating in evening and weekend meetings with school administrators. The evening and weekend hours did not decline during the 21-22 school year, as many had hoped that they would. The phone calls to parents became more difficult as the public's exhaustion and impatience with COVID started to take a toll. In this video clip, the school nurses reflect on what was keeping them up at night and what these past 2 years have been like emotionally.
This is a very difficult question. It was overwhelming. It was a place where I walked around and it was almost being that kid in 7th grade that nobody likes. I felt like the most hated person in the school community. And I was so busy and nobody could see all the things that I was actually doing to keep the school open, to keep everyone moving, and it was challenging. And so through this, I used the people who did support me. I used my health department, my fellow nurses, my building and grounds partner, my family, my significant other. I woke up every day and he said, Sharonda, you can do this. Sharonda, you got this. Sharonda, the work that you are doing will pay off. You can do it. Was there days that I did not want to come to work? Oh my goodness, absolutely. But I woke up early, I got here, and I got through it.
I also think something personally that was hard for me is I came from being in a hospital, worked in the hospital many years, and when you're a nurse in a hospital, everybody is always just happy with the care you're providing. My patients were grateful that I was there. The staff are grateful that you're there. And then coming into this role and then having COVID hit, I was always the bearer of bad news. Like when people would see the number come up from the district and, hi, this is Brent Larrabee, Coordinator of Health Services. Oh my God, was the response I got from a lot of parents. And so it's hard to, it was always negative, you weren't getting that, okay, thanks for calling me, or thanks for doing such a great job. It was, why are you calling me? Why are you doing this? I can't keep my kids home again. That was really hard for me to always have it be negative.
It's been really tough. I didn't know I was gonna get emotional. I think the first year when we were back here, it just felt really hard to be the bearer of bad news. So calling families and letting them know your kid has to stay home for 2 weeks was really not fun. And then I just worried a lot about what that meant for kids, just because some kids' school is their safest place to be. And I think another thing that's been hard is just, especially this year, people have so many differing views on COVID, and I just feel like we're just trying our best, and I think the community knows that we're doing our best, but there's just a lot of emotions and anger, and at the end of the day, I just really hope that the community sees that we love their kids, and just we're trying to do our best to keep kids healthy and safe and in school. I'd say another.
Those parents that were very angry. That's what would wake me up at 3 a.m. I was called a liar. And I'm a lot of things, but I'm not a liar, and that still bothers. It bothers me now. Mm-hmm. Why was I a liar? I think that's really it. And why did that bother me so? Well, you like to be liked, so. And then just worrying and wondering what's coming next. We just put something in place, and that's going to change. When is that going to change? The uncertainty.
Mm-hmm. Oh, a lot of things. Even the little things, when we were really busy, at times when we would have an outbreak at school, I would be up thinking, maybe I called 30 parents that day about quarantines for their kids. And I would be sitting up thinking, did I tell this one family this specific detail? Did I explain that quarantine didn't mean your kid can't come to school? It also means they shouldn't be going to grandma's into the store. And just worrying that I was forgetting these little things because I was on repeat mode so much with, calling these families and trying to be a soft sounding board, understanding I'm giving them probably some bad or scary news that their kid was in close contact with someone. And everybody reacts different. So always trying to be that neutral. You have one extreme parent who's so grateful and so worried, and they call you back 6 times to ask a little teeny question of, now, should they be staying in their room, or can they come out and eat with us? And then you have, the opposite of parents screaming profanities at you on the phone and telling you how ridiculous this is and obscene things. So always feeling like, I have this script in my mind when I was making those calls, but did I communicate all the details? So that would keep me up. And again, going back to that, feeling like I was in a moral dilemma of what I felt to be the right thing to do, and not feeling like that, how do you say that? Feeling like decisions were sometimes made based upon opinions instead of on actual fact or science, and then trying to find my right place in there and to keep fighting the good fight and doing what I needed to do with limit, with sometimes feeling like your hands are tied behind your back, but you still have to do it. Mm-hmm. So that was difficult. That caused a lot of nights of stress and worry.
Again, worrying about, one, I worried about, will I have a job? If school's fully virtual, I wasn't sure how long that would go. How long are they going to keep me around and keep paying me? But my biggest fear, the one that hurt my heart, was, am I going to lose a staff member, a student, community member, family member to this virus? That was really what I worried about the most.
Many of the nurses expressed that at some point over the past 2 years, they had thought about leaving their position as a school nurse. Although the first year of the pandemic was overwhelming due to the uncertainty and the constantly changing recommendations, the 21-22 school year seemed for many to be even harder.
Yes, absolutely, 150%. I became a school nurse. School nursing was the place where I can go to work and I could be my best, but I can also go home and I can support my kids. And my family did not have a mother, a significant other, a cook, a homework helper. They didn't have that because I was unable to provide that during COVID. My household divvied up a lot of things during this time because I did not have the energy to do it. My mental capacity was just done.
Yeah, I did. And it was, especially going into the second year, it was just like, can I do this? Last year, it was more of I felt like I was torn. I really should be working at the hospital. They are going under and they need help. And oh, that just could make me cry. I just felt like I could be used better someplace else. Like, what am I really doing here? And then I had a discussion with a friend who, she was managing the COVID unit at one of the local hospitals. And I just reached out to her because I'd seen her on TV, and I said, I hope you're doing okay. This is crazy. And she said, I feel really guilty. Like, I should be there. And she's like, oh my gosh, we need you doing what you are doing to keep people, your contact tracing, just the population that you're working with. She's like, you are going to keep people out of the hospital. So anyways, so that was one point where I'm like, I shouldn't be here, but she helped me feel better. And then this fall, it was just can I keep doing this? How much more? And then I was feeling like I wasn't being listened to this year because, like I said, school boards made decisions without any input from me at all. And that was tough. But I had to realize it's not personal, and they have a lot more people to listen to than just me. And what does our community want? What's best for kids? And I just, I had to take a step back, and I will just do what you need me to do, and I will do the best I can to keep our kids safe with the rules that we have in place.
Absolutely. Yep. I actually had applications out and was offered an interview. And my boss and the business director, if it hadn't been for the two of them, I would have taken the job. At least once. And several other times I had my resume put together and went and talked to my boss, and we made, what can we do to make this better for you? And she did. She fixed things. She supported me and made me feel like it was worth staying.
Yes, briefly, a couple of times. More so this year, I think the time, it just wore, wears you down, and you thought you were going to come back to something different, and knew fairly early on last summer that wasn't going to happen. And then things were truly just as difficult as last year, and two significant spikes here. So I did think about it. When I felt like I wasn't, there was more negativity coming from families and than positive things that I was doing. And all I was doing primarily was COVID. So there wasn't a lot of other positive feedback or feeling good about your job and feeling effective for a long time. But that passed, and you stick it out.
After hearing the challenges that the school nurses had endured, I was amazed that the nurses made the decision to not leave school nursing. On average, the school nurse salary is significantly less than what a nurse could make working in a hospital, home health, or clinic setting. All the school nurses were working well over 50 to 60 hours per week and were on call 7 days a week. The school nurses could have easily found positions that provided a better work-life balance. They could have acquired positions that did not require them to be at the center of controversy that many of them were in with their role in school policy development and enforcement. But ultimately, they chose to stay. Many of them shared that it was the love of the children, the staff they had the pleasure to work with, and a sense that where they are right now is where they are meant to be. In this video clip, the school nurses share what made them decide to stay.
Oh, these people, for sure. I love the students. That's one of the big reasons why I've stuck with it. School nursing is you're certainly not going to become a millionaire, but it works well for my kids' schedule. And the students are great. I love getting to build relationships with them. But through COVID, the thing that has made me not quit and do something else have been these people, the people in the office. My boss, I just really could not say enough about how amazing she was. I mean, really, she is easily the reason why I stayed.
I don't know. No, the administration said, who else is going to do this? You please consider this. Please consider. So I did. Deep in my heart, though, I feel this is where I was supposed to be.
The kids, the children at school and their smiling faces is the main thing. Also, just knowing that all of healthcare has completely changed. So sometimes I have to remind myself that any nursing job right now has completely changed from what it was before the pandemic. Everybody's doing things that they would never have expected to be doing or wouldn't want to be doing. It's just changed nursing, I think, as a whole, the pandemic has. And so sometimes I just have to put it in perspective that way, that, you know, it is what it is and we have to get through it. And I'm good at my job. I'm passionate about school nursing. So if this is what school nursing is right now, this is where I need to be.
I think the kids and just feeling like I was the woman for this job right now. Like I was here for this time, and I thankfully started before the pandemic. I can't imagine some of the nurses that started during the pandemic in their districts, but I just remember feeling like I would walk into work and just pray that I would be a peaceful presence here, because everybody was afraid. And, you know, we all were struggling with fear of, what if I get COVID? What if a loved one gets COVID? What does this look like? And then, you know, especially in the beginning when we didn't know a lot about it. And I just remember thinking, okay, I'm the nurse and I can be not freaking out and frantic. I would hope that that would be contagious. So I think just kind of that purpose, that just praying that I would be a peaceful presence here. And so for staff, that I would be a resource. They could come ask questions. I could help them figure out, you know, whatever it would be. And then for the kids, just that I would be a consistent person for them.
I didn't want to leave my team when I knew they needed me. I didn't want that to have to be a position that they were trying to fill, because I knew if I did leave, it would be very difficult to fill this position. And I knew that they needed support, and if they can take it every day, I can too.
I think we would have left if you left.
Yeah.
I think everybody would
Mass
have left.
exodus.
We have a good, very good leader.
Yeah. Well, they always say you have to have your why. What's your why? And as kids, that's easy. I love them and I want them to have a great education and a great experience while they're at school. And I feel like, you know, I think the reason I'm a nurse is because I had a child who ended up in the NICU and has special needs. And I just feel like every kid deserves to have that school experience. So it's easy. Kids.
Well, I must like my job because I've been here a while. And I'm still liking my job, and I'm liking it a lot better when COVID starts to decline. But that's, yeah, just that I'm still feeling happy here. I mean, even when I wanted to leave, my husband said, "You love this job. Don't let the pandemic get you down," because it did. Mm-hmm. It really did. Sorry.
It's okay.
It was an emotional time. Mm-hmm. Yeah, stressful.
Mm-hmm.
So, I thought about all the things that I really enjoyed doing, because I've always enjoyed school nursing. So I've never had days, months where I didn't want to go to work. I've always enjoyed waking up to go to work. I've always enjoyed providing cares to students. And ultimately, I still do enjoy that. And I do this work because I like to do it. I definitely do not do it for the money. I do it because if we don't provide students with preventative measures, with ways to care for themselves, families with opportunities to care for their students, who's going to do it? And if I'm not doing it, who is doing it? And I do it with passion. I do it with care. And this is what I enjoy doing.
Although most school nurses are the only healthcare provider employed by the school, they did not manage the pandemic alone. All the school nurses created or strengthened their relationships with their public health partners. Additionally, school nurses found support in nursing colleagues, school staff and administration, along with families and friends.
I did turn to some of my colleagues. We actually set up, like after the work from home day, we would set up Zooms sometimes and go out on our porches or decks, and then we would Zoom. a few of us at times. Just, I think they needed it, but I also needed it. So we would make that a priority, and we continue that actually, but now in person, trying to every month or a couple months get together outside of work. And that's hard for all of us that are busy, so it's a commitment, but it is.
I prayed a lot. I still pray. I pray on my way up. So my faith, the folks working down this hall, the counselors, we see each other at our best, we see each other at our worst. So
I have been, of course, very supported by my husband and kids at home, and I know that that's not always a given for everybody, so I, of course, want to mention them. I have been very supported by our superintendent. She has been communicative and incredibly supportive, as well as our business administrator. I mean, they sent me flowers in January when the cases were skyrocketing, and I mean, what a blessing that was, just to get flowers at my doorstep at home, to know that I'm seen and that the work that I'm doing is vital and that it's seen. I think those are such important things. Support by all of the relationships that I had mentioned earlier. Yes, every once in a while somebody's going to get angry and frustrated, but just knowing that everyone every once in a while needs a punching bag. Sometimes it's going to be you, sometimes it's going to be me, but to give people grace for that, I think if I was able to offer that support, more often than not, the next day somebody would call back and say, I'm so sorry I talked to you that way. And, to have the confidence and the ability to say, I know where it was coming from. That's totally fine. I didn't take it personally. You must be going through a really hard time. So that's completely fine. That ability to give and receive mutual support from our community has been priceless.
I definitely found support through other school nurses and, the Zooms that Louise would set up, and our district meetings, we would do some Zooms. And so it felt good just to hear someone else say they were going through the same thing. And other nurses in general, I have friends that I used to work with that are in varying settings, ER, clinic, and just connecting with them and sharing, their aspects of the pandemic and how it's changed their role and mine. And I just feel like only another nurse can really understand, our thought process and how we practice. So that was probably my biggest support, was trying to find other nurses. And I remember one of Louise's emails she sent, she just said, I see you. And just thinking about it and the stress, and then I was going through a really stressful time that week when she sent that, before winter break, and I see you nurses out there, and just acknowledging what we were going through.
Well, other school nurses for sure, which is why I was so thankful that we had started a Central Wisconsin School Nurses group. I think it's been 5 years ago now, and started out just with a few nurses, and then it has grown into I don't even know how many we have now, quite a few. But just to be able to have each other to commiserate with, even if we couldn't change anything, just to talk things through, or if you did have a really weird situation, that would be it. And even we got to know the people at the health department so much that there were times that I did reach out to our main contact at the health department and just say, hey, I hope you're doing okay. And just it was actually a source of comfort, believe it or not. And then just our school staff, because school staff are amazing people, amazing. And to just have those people they were great. They understood that as hard as it was to be in the classroom, they did not want to be the school nurse. A lot of them would tell me that routine.
As I mentioned earlier, the photos captured during my time in the schools show some lingering signs of the pandemic. But given the timing of the school visits, most of the images reflect the typical non-COVID related responsibilities of the school nurse. The school nurses rejoiced at finally having the time and the energy to focus on the activities and duties that made them want to become school nurses, creating a safe school environment in which every child has the ability to learn. The next several slides show photos that were taken during the school visits. As you will see in many of these photos, there is no evidence of the pandemic, but rather a return to more typical school nursing responsibilities. Students waiting in line outside the school nurse's office would not have been seen during the height of the pandemic. The nurse's office was reserved for kids who needed to be examined to determine if they had symptoms of COVID. School nurses also had to rearrange their offices and find spaces where ill students could be isolated from one another until they could be sent home. This photo was taken outside Suzanne Brinkman's office in Boscobel. School nurses frequently partner with colleges of nursing to provide clinical sites for community and population health nursing students. These collaborations had to be suspended during the 2021 school year. Partnering with school nurses offers nursing students the opportunity to learn about concepts such as care coordination, emergency preparedness, pediatric illness and injury management, along with health policy. This photo of Sharonda Farrington was taken at the Brown Deer Elementary School as she was talking with students from Concordia University. Kimberly Hess was excited to get back into the classroom to provide some health education on germs at Parkway Elementary School in the Glendale River Hills School District. Providing classroom education, a joy of many school nurses, was not possible during the height of the pandemic. Most school nurses were unable to complete yearly screenings such as vision during the 2021 school year. They were grateful that the time and resources allowed for this important nursing service to be provided this year. The photo on the left with Laura Baranek was taken at the preschool screening event held in the Edgar School District, and the photos on the right is of Suzanne Brinkman completing a vision screen on a student at the elementary school in the Boscobel School District. School nurses and students alike were happy to be able to see each other's faces and interact more easily. This is a photo of Jennifer Marsh from the Superior School District administering a daily medication to a student while another student waits for his turn. Instead of being a space where students needed to isolate from one another, for many, the school nurse's office has returned to a calm, safe space for students to rest for a few minutes before returning to class, as seen in the photo on the left, which is the health room at Spring Valley School District, and the photo on the right, which is Glen Hills Middle School in the Glendale River Hills District. This project provides a glimpse into several Wisconsin school health rooms, but one of the limitations of this project is that I was unable to capture images of the really behind the scenes work that school nurses do. For example, these photos show some of the more complex nursing interventions that nurses provide in the school. The first picture shows Kimberly Hess administering a G-tube feeding to a student. The middle photo is of Jenny Sauve meeting with a student with diabetes to calculate the number of carbohydrates in his lunch to determine the dose of insulin that he will receive. The third photo is a picture of Kristen Strong administering insulin to a student. What you don't see in these photos is the student's individualized health plan that the school nurse has spent hours developing. These photos don't capture the conversations that the school nurse has engaged in with the student's family, and their healthcare provider to identify student goals and measurable student outcomes. The pictures don't show how each time the school nurse meets with each one of these students, she is working with the student to increase their knowledge and their ability to manage their chronic health condition independently. The images do not capture the education and training that the school nurse has provided to school staff who interact with the student, the education and training that ensures that the school staff know what to do if the student were to experience a health emergency or complication. Fortunately, some of the school nurses were able to articulate some of their really behind the scenes work in this video clip.
I feel again like that's that atypical, how do you define a typical day? How could I say what I do? You know, I peeked at my annual nursing schedule that I just kind of update every few years and at this point know by heart, you know, what I need to do and when. And it's like 4 pages long. And then there's a section on what I do every day, every week. And then what are my deadlines and goals and tasks each month. And I think There's no way to define that unless I do a separate interview and look at those 3 or 4 pages. But that's what I would want to share. When I have a student nurse here, I have one from UW-Madison right now, and I take them from Clark as well, and sometimes Southwest Tech. They come in, and after the first week, even on a slow week, I had no idea. I really had no idea. And I think you would have to come in and be my health para, or you would have to come in as a board member or a school nurse, and you need to be there all day to see. And not just one day, but that week or the next week. Because I had several school classroom presentations on dental health and on blood pressure for 5th graders. Next month, shaken baby. So what about that teaching component? What about all the paperwork? The immunization review and all of those pieces that you do every year, and then what about the kids that are injured or ill, or the staff, or health plans and all of that. So there's just no really way to, I don't think, to bring that all together in a quick answer. I would say you would have to shadow me for a day, and if you came in at the slowest day, you would still be overwhelmed at what tasks then I dig into if there aren't students or staff at my door or the phone's not ringing.
I think that we do so much more than just put on Band-Aids and take temperatures, that, the nurses are really well educated and have to make a lot of critical thinking decisions every day. And that we're part of the mental health team at the school, that we do a lot of building relationships with kids so that when they have a crisis need, they know they can come to us. Getting the word out that the nurse is someone you can talk to if you need help. Kids who have been willing to come and talk about their eating disorders, that I wish there was more of that people knew that it was a safe place, that people understood that it isn't just the Band-Aid station, which I think is still how a lot of people think of school health in general. That, these are well-educated, well-trained people who are doing everything they can to keep your kid functional in school.
This one is a hard one. Yes, so school nursing is like being a mom. You walk in the house, and the house is clean, food is cooked, kids are managed. It looks really good. Moms make it look really easy. And school nurses, we make this look really easy. And that's because we love what we do. We're good at it. And if I could show people what we do, it is starting with nothing and creating health out of it. So yes, we have resources. I can't say nothing. But when we have a dental clinic, it doesn't just appear. We have called the doctor. We have set up the clinic. We have passed out permission slips. We have talked to parents. There's a process to everything. And if people would just know that school nursing is so important, and everything that we do, there are 10 steps to it before you see the final piece. And people don't see all the work that it took to get there. And that's what I would like people to just know. You don't need to see it. We're good at what we do. We don't need to show it. But for you to know that it exists and there's a step to everything, I created a process, because even with things like health plans, people think that, oh, you just write them. No, you don't. You have to interview the child. Interview the parent, get the medical, figure out the medical and what this child needs, and then there's a plan. So there are multiple steps to every single thing we do, and people just don't know that.
I wish they could see that, it is so much more than ice packs and Band-Aids, which is, what everybody, well, they do work magic sometimes, but there's a lot more to it. And if people could see, if they really understood some of the complex healthcare needs that we handle in a school where we are the only medically trained in any way person, I would love for them to be able to see that we're trying to make this so every kid can come to school and whether they need medicine or tube feeding or oxygen or suction or whatever it might be that we're helping with, that there's a lot more to it.
You know what, I think the trust speaks for itself. Yes, sometimes it's invisible work. Are we in the front of a classroom? Not typically. Are we going to be mentioned or have our work be seen? Probably not, because if we do things well, you just have healthy students who are being taken care of, and that's not necessarily noticeable. But I take a lot of pride in those relationships that are built and being, I think, probably still the #1 trusted profession in America for years and years running. And so that trust runs deep, and I think that that's world changing, even if it's not seen.
After today's webinar, I invite you to view all the videos and picture galleries of the 9 school nurses. The links to their individual pages can be found on the Wisconsin Association of School Nurses homepage. I also invite you to learn more about the history of school nursing in the United States by visiting the School Nursing Past and Present page on WASN's website. I'd like to end with this quote from the first school nurse, Lena Rogers Struthers. "School nursing is still in its infancy, and many changes and methods are to be expected, but the underlying essentials, child love and preservation of child health, will exist as long as child life." Now I'd like to introduce Kelly Barlow, President of the Wisconsin Association of School Nurses and District Nurse for the Shorewood School District, to share a closing and a thank you. Kelly, are you still with us?
I am. Hello.
Kelly.
Hi, thank you so much for having and truly putting this whole thing together. I wholeheartedly didn't think I was going to cry so much through this, but hearing everyone's stories and their struggles, I mean, it was so touching. So, but to all the nurses, I do want to thank you for your hard work and dedication to your students, your staff, and your families, throughout Wisconsin. Doesn't matter where you are in the state. Your dedication to student health during the COVID-19 pandemic truly set the foundation for their academic success moving forward as we move through, I don't want to say past because we're not past it yet, as we all know, but move through the COVID-19 pandemic. I know that that foundation is student health to ensure that they are set up for academic success. So whether you're a brand new school nurse or you have decades of experience, know that these few years have been challenging for us all. And thank you if you're new to joining, thank you for coming on. And if you, like I said, have been in it for decades, thank you for sticking with it, especially when it's been really trying. And listening to everyone and their trying stories was, it was wonderful. I didn't feel bad for everyone. I was like, oh, we are in this together, aren't we? So I know we've been through a lot since March of 2020, and truly I hope just being here today, this helps motivate you to keep doing what you're doing. And I hope that you all found support through your fellow school nurses. Thank you so much for showing up for your students and for being here today.
Thanks, Kelly. So on the screen is a QR code that will link to a short evaluation survey. If you would be so kind as to take a few moments after the webinar today to answer a few questions about this presentation and the school nurse photo essay project. And then we're also going to post a link to the same survey in the chat box. So if you don't have the QR code scannability, you can just click on the link and answer, I promise, just a few short questions. So I'd like to end today's webinar by thanking all of you for coming and hearing more about this project and getting to know the 9 school nurses that I had the joy of spending the day with, and hopefully have become friends with all of them. I would also like to end with a video in honor of Wisconsin school nurses. I asked Wisconsin school nurses to share a photo of themselves from the past 2 years and put it together in this video. So thank you everyone for coming today.
Here's to the ones that don't ever take credit. Here's to the ones that won't admit it. I hope you know we're all thanking God for you. And here's to the ones on call all night. Don't think twice about the sacrifice. Here's to the extra mile that you take it to. Yeah, here's to the frontline warriors, to being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to love, but you did, just to make them all feel better, yeah. You didn't have to pray all night. You didn't have to risk your life. If everybody loved like you did, the world would be a whole lot better. You didn't have to. No, you didn't have to. No, no.
You give it all like there ain't much to it. Fire's all around and you walk right through it. I hope you know we're all thanking God for you. Yeah, there's not enough words to say. You're a hero in every way. So I raise my glass for everything that you do.
Yeah, here's to the frontline warriors, to being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to love, but you did, just to make them all feel better, yeah. You didn't have to pray all night. You didn't have to risk your life. If everybody loved like you did, the world would be a whole lot better. You didn't have to. No, you didn't have to. No, no. Thank you, 'cause you didn't have to. Thank you, 'cause you didn't have to. No, you didn't have to. No, no. Thank you, 'cause you didn't have to. Thank you, 'cause you didn't have to. Here's to the frontline warriors, to being brave for all of us.
Thank you, everyone. Happy School Nurses Day. Have a great evening.